As an integrity commissioner looks over one Essex councillor's tweets, some are calling for more action. The stay-at-home orders mean those that took to the water for a break no longer have access. But one Windsor woman's hoping to change that. A live look outside, you can see the snow on the tower cam. It's been like this for most of the day here in downtown Windsor. It could continue overnight. Colette Kennedy with the details in her forecast. I'm Chris Hensing. Thanks for joining us. A jury has found former police officer Derek Chauvin guilty on all 3 charges in the killing of George Floyd in Minneapolis. Chauvin was convicted of murder and manslaughter in the death of Floyd after the former officer kneeled on his neck for more than 9 minutes during an arrest last May. Susan Ormiston reports from Minneapolis.
The crowd erupted, some with tears, some with chants, all 3 counts, as Judge Cahill read out the guilty verdicts against Derek Chauvin, the former police officer in Minneapolis. A large crowd outside the Hennepin County Courthouse is now celebrating. They believe that the right verdicts have been achieved and that their concerns about policing were heard inside that court. Derek Chauvin, charged with 2nd-degree, 3rd-degree murder and manslaughter, will be sentenced in the coming weeks. But for this crowd, they believe the verdict is just and the celebration has started. It took a relatively short time for the jury to come to the decision. Fewer than 10 hours deliberating. Many believed it would be guilty verdicts based on that time frame. The court now ends the jurors' go home, and the challenge of bringing George Floyd's death to conclusion, yes, with convictions, but now many in this crowd want real change with policing in America. Susan Ormiston, CBC News, Minneapolis.
And joining us now is Windsor lawyer Linda McCurdy. Linda, thanks for joining us during this moment. How does this feel for you?
Well, it's one that carries mixed emotions. Obviously, it was a relief to hear that verdict, given all that's gone on since Mr. Floyd passed away. But it's also not a celebratory thing, given that a man is dead and another man is been convicted of killing him. So it's a relief, but it's not a celebration, in my respectful submission.
And we saw the protests shortly after Floyd was killed last May here in Windsor. When you look at the verdict, how significant is that?
The verdict is very significant because it finally holds a police officer accountable for their actions, and it sends a message that the police are not above the law and that a jury can listen to the evidence and find a police officer guilty of murder or manslaughter if that is what the evidence bears.
And when you watch this trial, what stands out for you? What were the big takeaways from your position, as a lawyer?
Well, I mean, everyone's entitled to a reasonable defense. I think the defense put forth the best shot that they had, but the evidence that the prosecutor presented was overwhelming. I was very impressed by the witnesses they called with respect to the expert testimony concerning the cause of death. The case was very, very tight. And obviously having the video evidence and the evidence of people who were standing by was something that you don't see every day, that just made the prosecution's case that much stronger.
And in this case here, you mentioned that video. How does that change this trial in ways that it hasn't before when we've looked at what the United States has done in respects to police officers killing black men?
Well, this is one of the reasons why there's such a big push to have the body cams and those types of things, because these incidences occur in the United States and they've been occurring for many, many years. But to have it on video for people to see what's going on in real time in this particular case made a very big impression on people all around the world, and which is why you saw so much of a reaction following George Floyd's death, because everyone saw it.
And we saw that locally here in Windsor when we talk about those protests just across from Detroit. What can Windsor and the people on this side of the border do in this moment after this verdict?
Well, one of the reasons that we had protests and demonstrations here is because we have difficulty and we have issues with policing here in Canada. But part of the motivation was to show solidarity with the Americans who are right across the border, who, as I've indicated in the past, are very connected to people in Windsor, whether it be through family or jobs or friends. We have a great deal of connection across this border in particular because we have a great connection with the Americans. And we wanted to show solidarity with the movement across the border and show them that it's not just the United States, it's the whole world that's watching, and the whole world is putting forward the concept that Black Lives Matter.
All right, thank you very much for your time today, Linda.
Thank you.
That's lawyer Linda McCurdy joining us live on a significant moment in the history of the United States. Today, 49 new cases of COVID-19 in Windsor-Essex. 2 more people have died, a woman in her 70s and a man in his 40s. There are 461 active cases of COVID-19 in Windsor-Essex today. Of those, 133 are variants of concern. In total, for the region, 550 variants of concern. Today, the health unit says 477 are from the variant first found in the UK. Now, 2 are the variant that was first found in South Africa. As we watch other parts of Ontario push through a brutal third wave, Windsor-Essex has been holding steady, but more and more people are sick with variants of the coronavirus, variants that could leave the region fighting off 2 pandemics, according to Windsor's medical officer of health, Dr. Ahmed. I spoke with him earlier today.
That's what the concern is. We know the impact that it could have on the healthcare system. We have already seen the Toronto area and the GTA area. Their capacity is full. They're sending out patients outside, and we were blessed and we were lucky that we're not there yet. And our health system is holding on to what we have here, and we definitely don't want that. So yes, absolutely, it's critical that if things are not under control, we can go into the same cycle, people will die, and we don't want that. None of us want that.
Are there examples of how either easier or more transmissible this might be, or the way that this impacts a family?
Yeah, with the homeless shelter, I think that's a whole another beast because of so many challenges. But when it comes to workplaces or when it comes to schools, we do know that there are other public health measures already in place. And with the variant of concern that started to show up, there has been a number of changes in terms of guidance, in terms of the protection pieces. So we are blessed, at least in the sense that we had the opportunity to learn from other regions, from how a variant can impact. So we haven't seen it fully explode, and knock on wood, I just hope it stayed that way. But it didn't necessarily explode to that level that we will be really concerned about it. But we did notice that every time when we have a variant of concern, the entire family is now coming back positive. So that's why some of the guidelines now we are saying that if you are symptomatic and even if you're waiting for your test results, it is important that the entire family should stay home and only go for essential work if needed until you get the positive results back, right? So if you're symptomatic, then yes, definitely wait for the test results before you even go out. But if you're just even waiting for test results, those are some of the key things that everyone should concern.
Now, we told you yesterday hospitals in Erie St. Clair are already taking in patients from outside of the region as hospitals in the Greater Toronto area run out of beds. Blue Water Health in Sarnia took in its first out-of-region patient yesterday. They're gearing up for more.
We're looking at maybe potentially 1 a day kind of thing. We can handle more. We have capacity to help our neighbors in the GTA. But they divide up the volume based on, between the different hospitals who are willing to help or have capacity. And we're looking at 1 to 2 maybe a day.
Windsor Regional Hospital, Erie Shores, they say the 4 hospitals in the LHIN are expecting 2 patients a day collectively, plus ICU patients. Well, the Chatham-Kent Health Alliance says it's been asked to be ready for 1 patient transfer a day. We also told you about an internal memo yesterday that said the region's 4 hospitals will be getting about 60 patients this week, but that's incorrect. The group that issued that memo has since corrected that number, and their estimates are more in line with what hospitals understand to be coming their way. Ontario's hospitals are caring for a record number of COVID-19 patients tonight, both in intensive care and in general hospital wards. This has the hardest hit facilities in the GTA transferring those patients out more than before. Queen's Park reporter Mike Crawley has the story.
Hospitals in the Greater Toronto Area are now so full that they're transferring dozens of patients every day as far away as Kingston and London. The hospital system that's the most affected right now, William Osler. Its sites in Brampton and Etobicoke have had to transfer more patients than any hospital in the province.
I am very concerned about the potential for us to not be able to meet the demand of the pace at which patients will present through the front doors of our hospital.
With the transport and hospital systems working flat out now, there's fear about the prospect of a further spike of COVID patients needing critical care.
That's the situation that I'm most worried about, and I think is almost an inevitability.
The transfers are not a simple matter. The bulk of them are happening by road.
Essentially, it's taking that ICU that they're coming from and recreating it in the back of a land ambulance for that sometimes 2 to 3 hour trip.
Transfers were happening steadily in March, but the pace has accelerated dramatically this month.
We're pretty much maxed out right now. At this point, I don't believe we can provide more resources given our current circumstances.
The health minister says the transfers maximize use of the hospital system.
To make sure that if someone needs to be admitted to intensive care, whether by reason of COVID or some other reason, that we will have the space for them.
We are dangerously close to not being able to provide typical care in typical spaces to the patients who present with COVID-19 infection and others.
The number of COVID patients in Ontario's hospitals has more than tripled in the past month. It's now at a record high. The number in ICUs has doubled in just 3 weeks, also the highest since the pandemic began. The result? Hospitals receiving transfers from the GTA are filling up too, so they're having to send their own patients on to such places as Ottawa and Windsor. Mike Crawley, CBC News, Toronto.
At the Essex Town Council meeting last night, Councillor Chris Vanderdolen did not take an opportunity to apologize for comments he made on Twitter. Last week, he tested positive for COVID-19, but called it, quote, Chinese flu, quote, on social media. Well, an integrity commissioner is looking into the matter. Many are calling on the town to take stronger action. Jacob Barker has more.
Councillor Chris Vanderdolen had a lot to say yesterday evening about his experience with COVID-19.
It's day 15 for me for suffering from COVID.
But no apology, not even an acknowledgement of the tweet and subsequent comments that the councillor made regarding his use of the term Chinese flu. The only mention of the matter at last night's council meeting was that the town would be penning a letter of acknowledgement to the Essex County Chinese Canadian Association. It responded to Vanderdolen's tweet in which he called his diagnosis of COVID-19 the China flu and demanded he take it down and offer an apology. In an interview with CBC last week, this is what he said.
Maybe I could have worded it a little bit differently. But I have no regrets about talking about my disease and where it came from.
And the tweet still up on his Twitter account. Essex Mayor Larry Snively, who also called for the councillor to retract his statements and issue a public apology, told the CBC that council is waiting for a report from the Integrity Commissioner to come back on Vanderdolen's conduct before considering any disciplinary action.
I was very disappointed that the councillor Chris was not intention to do anything, really try to address it, and he seems to insist his position.
Ma says Vanderdolen hasn't lived up to standards for someone sitting on council and should step down. If he doesn't, he says town council should remove him.
I would respect their own procedure, try to do something right. On the other hand, I would say you can see that this is probably one of the reasons that there is existing systemic discrimination in our society. Our public elected officials should take responsibility to reduce it.
One councillor says the mayor's actions don't go far enough.
The mayor here should be really leading the way and showing the community that he's serious and that this isn't tolerated. There was a really good statement out of the mayor's office on the first day, the Saturday. But since then, it's like, oh, okay, let's let the integrity commissioner deal with it. I don't believe it would hurt us at all if we took a councillor off of committees.
Vanderdolen did not respond to our calls today. The integrity commissioner's report is due back the first week of May. Jacob Barker, CBC News, Windsor.
For the second day in a row, Premier Ford was not in the legislature. Health Minister Christine Elliott was asked about his absence.
The Premier has been very busy working to find more vaccines for Ontario and to assist in all of those efforts.
Elliott was one of a handful of Conservative ministers answering questions on behalf of the Premier in the legislature today. Liberal leader claims Doug Ford is hiding from criticism over how the government has handled this pandemic.
All of this makes it quite clear that Doug Ford is scrambling. He is flailing because the way that he's gone about dealing with the COVID-19 pandemic, particularly in the last few weeks, has been an unmitigated disaster.
Back in the legislature, Liberal MPP John Fraser pointed out that while the Premier was absent, he's still doing fundraising events.
While ICU admissions continue to rise, the Premier's priority this Thursday night is a $1,000 a ticket fundraiser in the middle of a third wave. What planet is that okay on?
CBC News requested a response from the Premier's office, but was directed to the PC party. So far, the party has not responded. Boat launches at marinas are closed as part of the provincial stay-at-home order, but a local woman started an online petition to get that changed. Dale Molnar has more.
I'll sit on the bow and I just lay there and just watch the sunset come down.
Sylvie LaFrancois and her husband own this 28-foot-long boat. Normally they can moor it at the city marina, but not only is the marina closed, the boat launch is closed too. With the thousands of dollars they have invested in this, they want to be able to use it.
I want the ramps to open so we can at least go fishing. It's you can distance, you can social distance on a boat. If you're just, my husband and I are going out there, there's no way that there's any danger.
She says they want to be able to sail for their mental health, and she also wants her dad to be able to launch his boat too. She has started an online petition calling for the boat launches to reopen. However, even though many boaters will take precautions, there are those that won't, such as ones CBC found last summer.
Yes, but if it's monitored, if people actually follow the rules, and I know a lot of boaters out there and they're careful.
The boat launch in Chewett Park is open because it is not a marina.
And the kayak launch in Stop 26 beach area is also open. So we're simply following the letter of the law and the spirit of the law for sure, making that closure happen. And I know it's frustrating because you can go to one place in the city but not the other.
LaFrancois says her boat is too big to be launched at Chewett Park. LaFrancois is hoping that her petition will make its way to Premier Doug Ford so that she can get the boat launches reopened.
I have Ford's number and I will send him a link.
Dale Molnar, CBC News, Windsor.
It is the secret of today's show, the snow in the background of every shot. Somehow today in April, we have snowflakes falling, so we found some beauty in it. Our front lawn here, a couple tulips, enjoying a little bit of the chill today. Colette Kennedy comes up next to say how much of this we're going to end up with. A major landslide in northwest Wales has officials warning people to stay away from the area. Now, the landslide happened yesterday in the popular coastal town of Nevin, about 4 hours north of Cardiff. The video from the air here, just unimaginable. Eyewitnesses say the collapsed cliff up to 40 meters wide. Emergency services, utility companies, they're securing the area. Backyards falling onto the beach below. Officials say slopes in the area are covered with weathered debris, can be susceptible to landslides, especially when they're saturated by water. Joining us now is Colette Kennedy. We are saturated by snowflakes right now. Colette, it looks beautiful, ugly, I don't know, but this is where it's like right now at a park by the riverfront.
Yeah, it all depends on your perspective, doesn't it? In terms of, you know, it is a wet snow that we are seeing. Started actually as the reporting station took it in as some showers and then kind of changing over to this wet snow. So Chris, let me walk everybody through what is going on with the month of April. It's behaving completely normally. That's what I will tell you. So a winter weather travel advisory in place, and I'm sure you can imagine why, looking at those images and what's been going on now for several hours here. So we will have some wet roads right on through to tomorrow morning and then begin to see some improvement there. So that carries on into well, almost towards eastern Ontario there. But look at the temperatures. Wow. Yeah, those have really taken a nosedive as well. And that's why we saw that kind of turnover from a little bit more liquid into this wet snow. Much of it will actually melt on the roadways because it is a wet snow. But then as you kind of saw there with the playground images, it can build up a bit more on grassier surfaces or other surfaces there that it doesn't necessarily melt so quickly. So showing you the imagery a little bit over enhanced here in terms of what's happening, but it is picking up this system. It's tracking to the south of the lower Great Lakes. I mean, the core of it is. And so that's why it's this sort of glancing blow that comes all along the shoreline there, northern shores of Lake Erie, and eventually on towards Lake Ontario as well. But I'm stopping this at midnight, still dealing with some of this wet snow, and then tomorrow morning, I'm not saying there won't be some flurries lingering back here, but we will begin to see improvements pretty quickly there. So that is definitely something to look forward to, but it is kind of cold as the system winds through. And then our temperatures will quickly rebound, which will be illustrated in the 5-day. Just hang in there with me. Up to a couple of 2 to 3 centimeters. The closer to the lakeshore, the higher the accumulations, but it's really the Niagara region that's looking at that up to 10 centimeters there. So I know it's been going on for a while, but really we're not going to be seeing a significant amount of accumulations out of this. Your temperatures then overnight tonight, we will see a few readings dropping below freezing, 1 degree. Well, we just looked at the numbers, right? But the temperature is going to be nearly steady and then kind of coming up a little bit, but just hanging right in there around freezing, okay, through the overnight hours. So be aware of that. And that tomorrow night, we're still looking at the freeze potential -2. So the high on Wednesday, just 7, and then look at that rebound. So anything is not going to last that we are picking up. And I will say that for the Windsor area, about 6 centimeters on average we would see in the whole month of April. So it's just that it's usually spread out with just a little bit here and there. And we're getting kind of one system with giving us a little dose right here.
That's it. We'll do buffet style, take it all that we can now, and then go on to the next. This is all right.
Everybody always overfills their plate.
No, absolutely. Thanks, Colette.
You're welcome.
The beautiful game coming under fire by the English Premier League, and fans and players want action. More when we return. Outrage is growing over a proposed new soccer super league in Europe. This was the scene in the English Premier League yesterday. Players from Leeds United taking to the pitch for their warm-up against Liverpool, one of the teams that's set to break away. The Leeds team wore shirts with the words "Earn It" on the front, as well as "Football is for fans" on the back. This proposed Super League will have 15 permanent members, not just Liverpool, but also Manchester City, Manchester United, Barcelona, AC Milan. Fans are furious too. They're using words like greedy and betrayal. The president of the governing body of European soccer is calling the owners of the rebel clubs, quote, snakes and liars. And there's news Spitfires fans don't want to hear. The Ontario Hockey League has canceled its season because of the pandemic. The OHL is the only one of Canada's 3 major junior leagues to do this. The league says it reached an agreement on a return-to-play plan with the Ontario government earlier this month. However, the stay-at-home order, along with increasing cases of COVID-19, made it impossible to play. And that's it for CBC Windsor News. Don't forget, for news anytime, you can go to our website, cbc.ca/Windsor. We're on social media too. You can find us on Facebook, Instagram, and Twitter. That's it for us. Thanks for watching. Have a great night.